Well, the PAC is established to raise money so we can support people that support our issues, support candidates, and support other government officials. So we will work with legislators during the legislative process, and those that we work closest with obviously support our issues and support our concerns. Most of you might be aware that New Mexico has always been a leader in clinical pharmacy practice in the United States. One of the first states to have pharmacists with the ability to practice at very high levels, our pharmacist clinicians. Pharmacists who can prescribe through protocols without supervision by a physician. Those are the kind of things that can only happen when we have a legislature that supports our agenda, supports our issues.
So pharmacy has had a long history of success in advocating at the state level for pharmacy practice. Whether that was the pharmacist clinician, the first advanced practice pharmacist law in the state way back in 1993, the advent of pharmacists with independent prescriptive authority in 2000, starting with immunizations, and since then we have added hormonal contraception, tuberculin skin tests, tobacco cessation, and most recently we have added post-exposure prophylaxis for HIV infection in order to protect some of the most vulnerable people in New Mexico. In 2020, a major step forward was the passage of the Pharmaceutical Services Payer Parity Bill, which mandated services that are provided by pharmacist clinicians and pharmacists with independent prescriptive authority to be reimbursed by Medicaid and by private insurers at rates the same as other healthcare providers.
So if a pharmacist does something that a physician might do, they're supposed to get reimbursed at the same rate as a physician. And as we all know, pharmacists are the medication experts, and so they're often called on to help their patients with medication issues. And House Bill 42 was passed and signed by the governor through the efforts of the various groups. It was a team effort. We all worked together and were very successful.
Coming in as a first-year pharmacy student, I felt very small, and as soon as we got involved with the New Mexico Pharmacists Association and the PAC, I came quickly to realize that the voice of student pharmacists is something that can be heard. We are not small, we are a big family, we are a group that makes changes. We can make change happen when we get all our collective voices together. So it's been an amazing experience to see House Bill 42 be passed through the efforts that I personally made as a student when I did not think that that would be possible.
We don't have a shortage of pharmacists in this state. We have a shortage of everybody else. We have a shortage of doctors. We have a shortage of nurses. I mean, pharmacists are really the second most educated healthcare professional in the country. And they have the skills, they have the knowledge. It should be used, it should be utilized. We have training a lot of students. They take 6-7 years to get through college, 8 if they go into residencies and other things. So it's a long education process that should be recognized. They have the skills, they have the ability.
The state has one of the most progressive pharmacy practice laws in the country, and the college has been great partners with a number of the professional organizations in order to get those laws passed. We are training the future of pharmacy in New Mexico, and as such, I, along with my faculty, staff, and more importantly, the students, are constantly advocating for the betterment of pharmacy and for patient outcomes across the state of New Mexico.
So upon graduation and becoming a pharmacist, I hope to continue supporting the PAC and staying involved with the New Mexico Pharmacists Association so that my voice as a practicing pharmacist can be heard so that we can continue to move the profession of pharmacy forward. If we're moving the profession of pharmacy forward, we're better able to provide better care to our patients. So I want to stay involved in as much as possible within the state because New Mexico is a very rural state and a lot of our patients are underserved. So I want to continue advocating for the profession of pharmacy to better advocate for our patients.
We support a lot of legislators that recognize what pharmacists do. They know how important it is to have a community pharmacist. It's amazing how many legislators will tell you that when they were a kid, they worked in a pharmacy. It's shocking how many of them there are, how many of them are in position to be supportive and be helpful and know what pharmacists do and what the education is.
This is a crucial time in the history of pharmacy and pharmaceutical services. We need to support the PAC in order to advocate to the best of our ability for the pharmacists of this state to be able to maintain the services they already provide and to expand those services to all around the state of New Mexico to increase access to primary care and to provide better patient outcomes.
As a student pharmacist, I would like to express my gratitude to the UNM College of Pharmacy, the New Mexico Pharmacists Association, and the PAC for advancing the way I will be practicing pharmacy one day.